To stop bleeding and properly treat a wound, you must have PPE, wound dressings, and a tourniquet. Before treating the wound, put on PPE. Next, apply direct pressure to the wound with a sterile dressing and hold until the bleeding stops. If bleeding does not stop, apply a tourniquet and write down the time of application. After stopping the bleeding, the wound must be cleaned in order to prevent infection. Begin by picking out any debris and skin fragments. Next, irrigate the wound with clean water. It is important to remove all foreign objects and clean the wound thoroughly to prevent infection. Once it has been cleaned and irrigated, a sterile dressing can be placed over the wound. Wound dressings should be replaced once a day or when wet. Check for infection regularly and keep the wound clean and protected. Infected wounds may present the following symptoms: redness, warmth, swelling, tenderness or pain, and pus. Red streaking around the wound or a fever are definite signs of infection. If either symptom appears, evacuate the patient immediately.